Have you ever woken up in the middle of the night, unable to move? A chilling dread creeping up your spine, a shadowy figure looming in the corner, and a pressure on your chest, as if a heavy weight is pinning you down? If so, you might have experienced what's known as sleep paralysis. Sleep paralysis is a type of parasomnia, a category that encompasses all abnormal things that can happen to people while they sleep. It's a peculiar and often frightening phenomenon, where you find yourself conscious but unable to move. It occurs when a person passes between stages of wakefulness and sleep. Now, why does this happen? Well, during rapid eye movement or REM sleep, dreaming occurs, and your brain shuts off most muscle function so you don't act out your dreams. But sometimes, this mechanism gets a bit muddled. You might wake up, but that switch doesn't flip back. The result? Sleep paralysis. There are two types of sleep paralysis. Isolated sleep paralysis, or ISP, can happen to anyone under severe stress, or who changes their sleep schedule suddenly. Then there's recurrent isolated sleep paralysis, or RISP. This can last anywhere from a minute to an hour and can be a sign of narcolepsy, a chronic sleep disorder that causes overwhelming daytime drowsiness. The pathophysiology of sleep paralysis is quite intriguing. It involves a disconnect between the brain and the body as you transition between sleeping and waking states. Normally, when you enter REM sleep, your brain sends signals to inhibit motor function, essentially causing a temporary paralysis to prevent you from acting out your dreams. However, if you awaken before the REM cycle completes, your brain might still be in this state of motor inhibition. Hence, you're awake, but you can't move. Fear not, though, for sleep paralysis, while terrifying, is generally harmless and treatable. It's crucial to maintain a regular sleep schedule, create a comfortable sleep environment, and limit caffeine and heavy meals before bed. For those with RISP, a doctor might prescribe certain types of antidepressants that can help regulate sleep cycles. In conclusion, sleep paralysis is a fascinating and eerie manifestation of the complex world of sleep. It's a temporary disconnect between mind and body, a glitch in the system as you transition between sleep and wakefulness. While it can be terrifying, remember that it's not dangerous, and is often a sign that you need to pay more attention to your sleep health. So the next time you find yourself in the grip of sleep paralysis, take a deep breath, remember it will pass, and perhaps take it as a reminder to catch a little more shut-eye.